The battle against cancer is personal. When I was doing a research fellowship in oncology, my father was diagnosed with multiple myeloma. I was on faculty, and my mother was diagnosed with pancreatic cancer, and so really wanted to dedicate my life to help patients with cancer. I actually faced a cancer diagnosis myself, and I can tell you it was completely terrifying. I see patients with cancer every day, and I'm inspired by them. So our group is really focused on trying to better understand why immunotherapy works in some patients but doesn't work in others. And we studied a cohort of patients who were treated with immunotherapy, and patients who responded to the immunotherapy had a higher diversity of microbes within their gut, which is generally associated with better overall gut health. And secondly, that they had different bugs in their gut, so they had a higher abundance of specific bugs. It was really profound when we started to study the microbiome in patients with cancer and saw really night and day differences in the gut microbiome of patients who responded versus those who did not respond. And so can we actually change the microbiome to positively impact immunity and immunotherapy response?
It's really changed the way we take care of melanoma patients. We're finding ways to avoid surgery. We'd like to work ourselves out of a job, and in some ways Dr. Wargo has been able to do that for melanoma patients.
I think the key thing that a scientist has to have is, first of all, curiosity, wondering about how things work. I think she's got a lot of that, as shown by the diverse things that she's worked on.
So in addition to the microbes within the gut, what's really important about them is their function, and how can we change the function of these microbes?
Microbes train our immune system, and the mechanisms of that are not well understood, and our job here is to try to get answers around that.
The role of the gut microbiome in cancer immunotherapy response is really here to stay, and is potentially could become the next pillar of cancer treatment.
She's just a wonderful collaborator and a generous person, and she really believes in lifting, do things that lift everybody.
MD Anderson Cancer Center is a pretty special place. Everyone here is dedicated to patients. They all care about these patients and do their best. When I meet patients, I connect with them. I want to be there for them. And I'm constantly inspired by them.